Oh, damn it.
What was that, Michelle?
No, I thought I lost you guys.
Okay, so here we go. So, Mr. and Mrs. Jones, is it okay if I take just 5 minutes to explain Medicare to you in a way that you'll remember it and you'll understand it? Is that okay with you? Typically,
Yes.
people say, oh, please, yes. Okay. So I start off with, okay, so let's talk about original Medicare first. Original Medicare. What does original mean? Original is the first, right? So when Medicare was invented, this was original Medicare. Okay, Medicare pays 80% of your medical bills. You are responsible for 20%, and Medicare has no out of pocket limit. So if you have $10 million worth of medical bills, you have a $2 million co-payment, co-insurance. Okay, that is original Medicare. Original Medicare consists of three parts. Part A is the hospital. What does that mean specifically? That means having insurance that covers you when you are inside of a building, a brick and mortar building. That's why you hear it called inpatient, because you're inside of a building. The deductible for 2025, let me pull it up real quick so that we have it. All right, to show you guys, write it down. Part A deductible for 2025 is $1,676. $1,676 per benefit period. A benefit period, as you can see here, is a 60-day period after a hospital stay, 60 days. So if you go in on day 61, you have to pay another $1,676. If you work for 10 years and you pay into Medicare for 10 years or 40 quarters, there is no charge for the Part A coverage. It is premium free. Now, and while you're in the building, part B is your medical. Medical means everything that they do to and for you when you are inside of a building called a hospital or as an outpatient at a facility or a doctor's office. You're outside of a hospital. The deductible for 2024 was $240 for 2025. Part B deductible for 2025 is $257. $257. Okay. Now, if you do not enroll when you are entitled to enroll into your Medicare Part A and B, if you do not enroll in their time frame, you will incur a late enrollment penalty. Late enrollment penalties when it comes to Medicare, you pay those penalties every month for as long as you live. Technically, for as long as you have Medicare, and for most people, that's going to be for the rest of their life. Now, after you get leave the hospital, after they get done doing to and for you everything that they do to and for you, they send you home, but they send you home with little pieces of paper called prescriptions. So by law, you have to have a way to get your prescriptions to continue your treatment and get better. So that's when part D, as in for drugs, comes in. You have to have that part D coverage within 63 days of enrolling into part B. Or if you delay Part B, which means that you're getting insurance through your job and you don't need Medicare yet, anytime that you leave your job and you enroll into Part B, you have 63 days to get your drug coverage, or you will be paying a late enrollment penalty for the rest of your life. Credible coverage means that the coverage has to be as good or better than Medicare. So credible coverage means that the coverage that you have, whether it be through work or the employer, is as good as or better than Medicare. That and that alone, hospital, medical, and prescription drugs, that is what is considered original Medicare. Now, you have a 20% out of pocket with Medicare. There are three ways to cover that 20% that Medicare doesn't cover. The number one option is to pay that 20% out of your pocket. For most people, that 20% being paid out of pocket just doesn't make sense. Okay. Number two, the other option is called a supplemental plan. It's known as Medigap, Medigap plans. Supplemental plans are not health insurance. Supplemental plans are a financial company that is giving you a contract that you will pay a premium for every month. It's cash for cash. You pay the money in premiums, whether you use your health insurance or not. And when you do use your health insurance and you have co-payments and you have co-insurance and you have medical bills, the insurance company that you're paying the premium to for the supplement plan will come in and pay the bills for you. You pay them cash, and when it's time for the doctors to get paid, they come in and pay cash on your behalf. That and that alone is a supplement plan. It's real simple. There are A through N. There's a whole bunch of plans. All those plans are exactly the same no matter where you buy them. It's the same benefits for Plan A in Alaska that it is in Miami, Florida. Same benefits. The only difference between supplement plans is going to be the premium, depending on where you live. Premiums in New York City are going to be a lot higher than premiums in Cleveland, Ohio. Okay, so that and that alone is a supplement plan. Now, the third way, most popular way nowadays to cover that 20% is going to be with Medicare Part C, also known as Medicare Advantage. That's what you see on TV all the time with the dental, the vision, the hearing, transportation, over the counter benefits, gym memberships. Those are Medicare Advantage plans. They call them Medicare Advantage plans because there's a lot of advantages over just having original Medicare. As a matter of fact, the reason that Medicare Advantage plans exist is because at some point, Medicare was like, oh, these are tens of millions of people. This is a lot of responsibility. Let's get some health insurance companies to come in and take care of these beneficiaries for us. We'll pay them a flat fee. And how do you get beneficiaries to go from original Medicare to Medicare Part C? They said, offer them stuff that they can't get with us to entice them to go and work with you. And that's why they have all these advantages. Now, the biggest advantage with Medicare Part C is called the MOOP, or the maximum out of pocket, something that Medicare alone doesn't have. These advantage plans have maximum out of pockets. Let's say, for example, the average out of pocket nowadays is $4,500. What that means is that if you have $10 million worth of medical bills, you'd owe $2 million to Medicare, or you'd be responsible for your $4,500 maximum out of pocket. Which one would you rather have? Now, that $4,500 maximum out of pocket only includes three things. It is the money that you spend on deductibles, which is how much you have to pay before the insurance company kicks in. Co-pays are a flat fee. If you hear a doctor say you have a $20 co-payment, that's all you're going to pay. And co-insurances. Co-insurances are percentages that you pay. Any number that you see before the percentage sign is how much you're going to pay. If a doctor has a 20% co-insurance, for every $100 that he charges, you are going to be responsible for
20%.
20%. Okay. The only thing else that you need to know about Medicare is the difference between HMO and PPO. How many of you know the difference between HMO and PPO? I ask clients this all the time. They have no idea. So I say, okay, an easy way for you to remember the difference between these two is if you add an E to HMO, you could spell home, like the house that you live in. So every time you see HMO, I want you to imagine a home. And in that home are all these services, everything. Doctors, nurses, surgeries, ambulance, emergency room, they're all in the house, but you can't leave. You have to get all the services in the house, or in other words, in the network. Now, a PPO, which I say is patient's party outside, has a home that's identical to the HMO, identical, has all the services that you can imagine inside the house. However, you can leave the house anytime you want without having to ask for permission. You can see any doctor that is willing to bill the PPO that you have. If you have a United Healthcare PPO, but the doctor only takes payment from Aetna, you're going to end up paying out of pocket if you use a United Healthcare PPO. So you have to make sure that the doctor accepts it. The only things, the biggest differences between these two plans are that with an HMO, since they can track your spending because you're in the house, they give you, yes, less flexibility, but they'll typically be able to give you more benefits. With a PPO, you get a lot more flexibility. You could go any way you want. But since you're spending money all over town, they can't keep track of how much it's going to cost to take care of you. So they will typically give you less benefits. I use the word typically because there are exceptions to every rule, and sometimes, yeah, a PPO could give you more benefits than an HMO. The last three things about Medicare that you need to know are these three things. AEP, which is the annual enrollment period. That's when anyone can enroll into a Medicare plan. That is October 15th to December 7th. The open enrollment period is from January 1st to March 31st. That is a 3 month trial phase for the new plans that you enrolled in during the annual enrollment period. The government gives us 3 months to make sure that the plan is working. And if it doesn't, we have permission to make one change. Okay, and that's the plan that you'll be with for the rest of the year. Special enrollment periods or SEPs, there are about 25 to 27 of them at any given time. These are certain circumstances that arise that prohibit people from enrolling when they can, such as disasters, or they move from one place to another, they get married, someone dies. Those are all special enrollment periods that allow you to enroll outside of the annual enrollment and open enrollment periods. That and that alone is Medicare in a nutshell. Are there any questions about this? You guys got it? You guys got it? Okay.
Yes.
Okay. So the next time we meet, you guys need to practice this. I want you to explain Medicare to me next time. Let's go through the Medicare one-on-one so you can understand the difference between what we do now and the competition that we have out there. Pause this recording for a second. Okay, so thank you for that amazing introduction. Whatever, Michelle, whoever introduces you, you thank the people that introduce you. Hello to all, and welcome to the Emmy Pow Insurance Educational Event. What does Emmy Pow mean? It means it's our name, our motto. It's how we conduct our business, how we treat our customers and our customers' time. It means every moment is either priceless or worthless. Having power is a way of life for us. Okay. With that in mind, let's not waste any time and let's talk about Medicare. Can anyone tell me here on this phone call what is Medicare and who does it serve? Quickly. Susan, what is
It
Medicare?
is Medicare is a um, insurance for 65 and up and shoot, I'm going to say the words.
Okay.
Special people that have the Sorry, I lost that one.
Okay. Okay.
Let me get my notes. The, is it the renal failure
ESRD.
and um, anybody who's disabled um, that would need the special time to enroll before they hit 65?
Which is how many months do they have to be on disability before they qualify for Medicare?
24.
Well, I was going to say
It's
1 year.
20. It's 24 months.
24 months. Okay.
Yes. Once they are on SSDI for 20, not SSI, that's Social Security.
Mhm.
Yeah, it's
It's Social
what's it
Security
called?
disability.
Supplemental income. It's social
Okay.
supplemental income, SSI. There's two of them, SSI and SSDI.
SSDI. Okay.
SSDI is Social Security Disability Insurance. So when you have that for 24 months and you're getting a disability check for 24 months, it automatically qualifies you for Medicare.
Medicare.
All right. So now the proper lingo is that Medicare is a federally, you could write it down. That's how you
Federally,
explain it. Federally what, Rick?
federally, federally insured program,
It's a federally
regulated insurance
health insurance program, right?
program for people over 65 years of age.
For senior citizens. Now, did you do me a favor? Open up that 101 final PowerPoint that I gave you. Let me know when it's open.
Yep, I got it.
Okay. Michelle, Susan, got it?
Just click
It's
on the
pulling
one
up
in the
now.
chat.
It's pulling
It
up now.
wasn't open for me. Give me a sec.
Do you have PowerPoint on your computer?
Yeah.
Okay. The reason why I'm
No.
asking you to open it is real simple, okay? Um,
Yes.
all of the notes are in the presenter view. So if you go to the first page, it's going to be slide number 2, I believe.
Yes,
Yeah,
it is
slide
too.
number 2, when it says Medicare. All right. Rick, read the verbiage.
Medicare is a federally regulated health insurance program for senior citizens, nationals, or lawfully present in the U.S. over 65 years old, for people under 65 years old that are on disability for more than 24 months, and for people with ESRD or end-stage renal disease.
So these notes that are in there, this is what I use when I'm doing the 101. So this is, you ask me, Rick, all the time. I don't know, how do you come up with that? It's right here. So learn these words. Okay. So let's keep going. So it is for US citizens, nationals. You have to make sure that you bring it out because you're giving them the right information. Nationals are those lawfully present in the United States, ages 65 years or older. For people under 65 with a disability and they're getting a Social Security disability income for 24 months or more, and for people with ESRD and stage renal disease. Now, when can I enroll? The initial enrollment period for most seniors, and guys, if you can, follow with me on your PowerPoint on the side if you have an extra screen. All right. So, Rick, read when can I enroll, please?
I'm looking for it here. Where did it go?
Susan, you got it, Susan?
Yeah. The initial enrollment period for most seniors are the 3 months before, a month of, and the 3 months after the month of your birth. There are some additional enrollment periods that you need to know about, and there are 24 or so enrollment periods.
I'll have to fix that for you. When can I enroll? I want you to look at this slide,
Okay.
especially the top right-hand corner. It
Okay.
spells it out real simple. You see 65? That's the month of your birth.
Mhm.
Okay. 3 months before it and 3 months after it. Now, just so you know, as agents, if you enroll in the 3 months before it, it starts on the first day of the month of this person's birth. If you enroll in the month of the 65th birthday, now coverage begins the second month, the first month after your birth. If you wait to enroll, you will have to wait yet another month. And then after the third month, now you're into late enrollment penalties. Understood? That's how that works.
Okay.
When can I enroll? Then you say that after the month of your birth. There are some, when I say this, there are some additional periods that you need to know about. We just went over these. The initial coverage period, which is the ICEP, that is when you first turn 65. There is an ICEP number two. ICEP 2 is when someone gets Medicare because they're on disability and then they also turn 65. When they turn 65, they get an automatic enrollment period. Okay, that's the ICEP 2. We spoke about the annual election period. That is when anyone can enroll into Medicare. That is from October 15th to December 7th. The third special enrollment period is going to be one that you don't see here, which is the open. Well, you do see it here. Special election periods, there are 25 to 27 different reasons why you can enroll outside of these times. The other enrollment period is the Medicare Advantage open enrollment period. This is the time that you have 3 months from January 1st to March 31st to try out the plan that you've selected to make sure that it works. Those are when you can enroll. Okay. So A, B, C, D. What does all this mean to me? Let's talk about the basics. Part A. Part A means a hospital, a brick and mortar building. That's why it's called inpatient. Part A comes premium free if you work 10 years and 40 quarters and you paid into Medicare. Now, when you're in the hospital, you get Part B, which is medical. Medical is everything they do to and for you when you are in a hospital or outside of a hospital in a facility or a doctor's office, in or outpatient. Everything they do to and for you is considered medical. Now, after you leave the hospital and they've done everything they're going to do to and for you, they send you home with little pieces of paper called prescriptions. So you need to have a way to get those prescriptions. That is by Part D, which is the prescription drug plan. Within 63 days of getting your Part B, you have to have your prescription drug coverage or you incur a late enrollment penalty. So, to recap, A, B, and D are considered original Medicare. That's how it started out. Now, Medicare pays 20%, Medicare pays 80%, you pay 20%. And there are three ways to cover that 20%. One of those is Part C, Medicare Advantage. The reason it's called Medicare Advantage is because it has a lot of somebody question? No. The reason that it's called, and let me just read it, A, B, and D are known as original Medicare, something I would never have because there are better options, two better options, actually. One of them being Part C, also known as Medicare Advantage. Now, to understand Medicare Advantage, let me tell you what it is. What it is, the difference is pretty simple. Original Medicare pays 80-20, which means that they pay 80%, you pay 20%. There are two ways to cover the 20% gap. Number one is Medicare Advantage or Medicare Supplement. What's the difference? It's pretty simple. Medicare Supplement, also known as Medicap, is a private financial company. They do not come with a PDP. So you're going to need to purchase a drug plan in addition to your supplement if that's the way you're going to go. Medicare supplement companies are cash for cash. You pay them a premium every month, whether you use your insurance or not. And when the bills come due and it's time to pay the doctors and emergencies and ambulances, this company comes in and pays it for you. Again, it does not come with a prescription drug plan. You need to get that in addition to the supplement if that's the route you go. Medicare supplement plans, they also have letters. These plans are from A to N. You can see the different coverages here. Um, all these plans are the same no matter where you go or where you are. The only thing that's different is the price you pay depending on where you live and the plan that you pick. These plans, for some people, they make sense. For example, um, someone who uses the doctor and has a lot of surgeries, goes to the ambulance 30 times a month. This is a plan that makes sense for them. That is Medicare supplement. That's it, nothing more, nothing less. Now, Part C is called Medicare Advantage because these plans come with many advantages that you don't get with original Medicare or Medicare supplement plans, such as dental, vision, hearing, gym, transportation, over the counter benefits, just to name a few. But the biggest advantage, and the reason why I said I would never have just original Medicare, is called the maximum out of pocket. Maximum out of pocket is what you pay in deductibles, which is what you pay before the insurance company starts kicking in. The next thing that it includes is copays. Copays are flat rate. For example, if a doctor has a $20 copay, you go in, they say it's $20, that's all you pay. Finally, included in the maximum out of pocket is your co-insurance. Co-insurance is a percentage of the bill. For example, every number that you see before the percentage fine is what you are going to pay. So if the doctor has a 20% co-insurance and he charges $200, your co-insurance is going to be $40. $100 doctor fee, 20% is $20. I'm sorry, I skipped over that. Once the maximum amount of pocket is reached and you have paid the maximum amount of pocket in deductibles, copays, and co-insurance, the insurance company pays 100% of your covered medical expenses for the rest of the year. You have to specify that loud and clear. Your covered medical expenses. If you say that the insurance company pays 100% of your medical for the rest of the year, you just got yourself a problem if they go and get a nose job. Understood? So yeah, these have to be
Question.
yeah.
Okay. They go in the hospital, they pay their copay, their deductible, their maximum out of pocket. 60 days later, they go in again. They've got to pay their deductible.
No,
No?
because Medicare Advantage plans cover you for a 90-day period, not 60.
Okay. So what if they go 91 days then? Do they start all over again?
Yes, sir. After 90
Okay.
days, you got to kick in all over again. So whatever deductible and whatever copay you have for the hospital.
Okay, and then another maximum out of pocket, or is that covered in
No, it's one out of pocket for the whole year.
for the whole year? Okay, that's what I needed to get clarified.
Okay, perfect. So now, after this maximum out of pocket, let me give you an example of what maximum out of pocket means. Over here, Medicare.gov, you can see that there's no yearly limit on what you pay out of pocket. Okay, no yearly limit. So let's take, for example, $1 million accident. 20% co-insurance is $200,000. And once again, there is no limit. Let's take a look at a Medicare Advantage plan. As you can see here, the maximum out of pocket is $4,500 in network. You'll see also $4,500 combined maximum out of pocket. What that combined means is that you're using doctors that are in and out of network. Sometimes those combined out of pockets will be higher because you're using the privilege of seeing any doctor that you want. But here's the bottom line. If you have $1 million bill, you're either going to pay $200,000 to Medicare or you'll be liable for 4,500 bucks. Which one would you rather be liable for? So we've reached a halfway point here. That's what I say to people, and I take out a piece of paper. at this halfway point. And I say, you see this piece of paper here? Okay. We're at the halfway point. I know this is a lot to process, and I don't expect you to remember all this stuff because as a human being, this applies to all of us. Everything that you heard me say is right here, right now. But by the time you have dinner tonight, you're going to remember this much. By the time you get up tomorrow morning, you're going to remember this much. The fact is that human beings forget 75% of what they've heard within 3 days. Within 3 days, this is how much you remember about everything that we spoke about right now. There's only one thing that you need to remember about Medicare, and one thing alone. It doesn't matter what you know or don't know about Medicare. What you need to know is that we know Medicare. Okay. So let's take a break here. And you know what I'll do? I will pause this recording here now.